Welcome to Close Up on America's Business, the program that takes you inside some of the most unique and successful companies in America. I'm Jim Masters. On each edition of our show, we introduce you to some of the most innovative business leaders in the country today. You'll discover what their products, services, technologies, and business models can do for you, what they're doing to change our world and change the way we do business.
Let's face it, you feel better about your smile, you feel better about yourself. But not everybody loves going to the dentist. Well, today, we'd like to introduce you to a dentist that's out to change that. Hi, I'm Janice Marie with Close Up on America's Business, and we're here today in Hackensack, New Jersey, at the office of Dr. Judith Mama and Designing Smiles. Now, this is one of the most comprehensive full-service dental practices in all of northern New Jersey, specializing in cosmetic and sedation dentistry, which can give even the most nervous patient a great reason to smile. Let's take a look.
Designing Smiles is a full-service dental office, and we do general dentistry, and we specialize in cosmetic and sedation dentistry. Someone's smile is very, very important because many times you don't realize how important someone's smile is until you do something about your smile and you realize that it changes your whole personality and outlook just by changing your smile. Many times patients don't show their mouth, their teeth when they smile. They kind of smile and hide their faces or hide their smile because they're self-conscious. And then after we do whatever dental procedures we do to change that smile for the patient, they're so confident and they smile now.
One of the specialties here is sedation dentistry. And with that, the doctor has patients come in that are afraid, that haven't been to a dentist in like 8, 10 years, sometimes even longer. So they need a lot of work done. And they're afraid, so that's why they haven't been to a dentist. Either they've had a bad experience, it was traumatic to them, and they just don't want to come back. But between referrals and other patients bringing in their families, they do come, and Dr. Mama sits with them. She'll talk to them and relax them before they even get into the dental chair. And with that, it just helps them relax. And in this office environment, it's very relaxing. There's, no diplomas on the walls, and it's relaxing to come here.
Dr. Mama was very kind, very professional, non-judgmental. I really was embarrassed to open my mouth. I even told him prior, I'm so embarrassed. I'm a professional in the medical field, and I was embarrassed that I let this happen, but I was petrified of dentistry, of feeling the pain and the whole thing. So if you have these phobias about dentistry, call Dr. Mama. You're not going to regret it. She is really a great dentist, professionally, friendly, very spiritual. You really feel very comfortable.
Let's say someone has relatively healthy teeth, but they just want their smile to look better. What can you do for them?
Some of the options we can offer patients that have maybe spacing or crowded or overlapping teeth are braces. These days we do Invisalign, which is very convenient for adults, especially professionals. And I get to do them a lot of professionals because you can wear these aligners and you don't know you're wearing anything, but they are designed to move your teeth and correct your bite. So we do that. We sometimes do veneers, porcelain veneers. That's a 2-visit appointment, and with veneers we're able to change the shape, the color, and the size of your teeth. And sometimes people just need their teeth to be whiter and they have no problems with the shape or color or size. So we whiten their teeth by doing bleaching. It's a less invasive procedure and you still get the white smile that you want.
One of the things that our patients like the most and appreciate most about coming here is the fact that they feel comfortable, that they feel warm, that they don't feel like this is just a dental office. They feel that the office is warm and welcoming. And once they relax, then we go into the procedure. We put together all the needs and prioritize what's most important. So what she tries to do is first try to keep them in a balance where their health is stable. And after that, once they're stable health-wise, then you can look into aesthetics or ortho or anything that the patient wants to do. Our main goal is to make them comfortable and stable them health-wise, just not in the mouth, but in overall body, and a state of mind of being comfortable coming into the office.
Normally what we do is you have two options. We can start the sedation in the office, or we can give you the medication to take at home about an hour before you come to the office, so that when you come in, the medication has already taken effect. After we are finished with the procedure, someone has to take you home. And then when you get home, most of the time patients just eat and go to sleep, and then when they wake up, they have a new smile or they've had their dentistry done without any problem. Now we put the oxygen mask on, to make sure she has enough oxygen getting to her system. Her heart rate also has dropped now because she's now more relaxed. Initially, when the patients come in, their heart rates might be high because they're anxious and their pressure might be a little high. But as soon as the medication starts to take effect, they become completely relaxed. But the good thing about conscious sedation is that the patient is still easily responsive. Like, I can talk to her, she can answer me, she has her reflexes, she's comfortable, very comfortable. So this topical anesthetic is to numb her gums and numb the area that we are going to give the dental anesthesia. So that way she does not feel it as much.
My teeth started to break up and fillings started to come out, and I love to eat nuts. And looking back, I guess I would have not eaten those nuts had I known they were going to cause my fillings to come out. By that time, my daughter had met Dr. Mama, and she told me about her and how, Mommy, you can go there and have sedation. You don't have to worry about the pain. She's really very nice. She's very gentle. So why don't you try her? And that's what happened. I came here and I found everything that my daughter said about her to be true. I come now without the fear that I used to have. And everything is going so well until I'm telling other people about her now.
Today, we're going to work on the left side of your mouth now, because we worked on the right side last time. And it looks great. The right side looks so much better compared to the left side. We're doing a gum treatment for this patient. He had adult periodontal disease, simply put, gum disease. So what we normally do is to numb the patient, and then we use our ultrasonic instruments to clean the root surfaces and to remove whatever infected tissue that is under the gum. The patient doesn't feel whatever we're doing because he's numb. So the anesthetic helps the patient, and that way we're able to do the procedure without discomfort to the patient. How are you doing? Good? Yeah. Okay. Does it feel a little numb up here now? It does? What about back here? Does it feel a little numb yet? Okay, can I have some more topical, please? Okay. After we are finished with the procedure, someone has to take you home. And then when you get home, most of the time patients just eat and go to sleep, and then when they wake up, they have a new smile or they've had their dentistry done without any problems. Our philosophy is to provide dentistry to our patients in a very comfortable, homey environment. Office is very relaxed. Many times patients tend to fall asleep while we work because we make them very comfortable. We let the patients relax and we do all the work. And we always have this slogan that our dentistry changes lives because we've seen it a lot in our patients. I say that the mouth is the gateway to the body. So if your mouth is unhealthy, you can be sick. Nowadays, research has shown that there is a link between periodontal disease, gum disease, to heart attacks. So if you do not take care of your mouth, you can be very sick and not realize why you might be having a heart attack. Now anyone can have great dental care without fear.
So here's what happens when you visit Dr. Judith Mama. You have a great reason to smile. Reporting from Hackensack, New Jersey, I'm Janice Marie.
That concludes this edition of Close Up on America's Business. If you'd like more information about any of the companies featured on today's show, please visit our website at closeuptvnews.com. I'm Jim Masters. Thanks for joining us, and we'll see you next time.